Welcome to 17.1 All Scripts Upgrade Training. The video you will watch today will demo the new functionality and features. Our clinical technology team is committed to bringing you a system which makes it easier for you to take excellent care of your patients and meet the new regulatory reporting requirements. Welcome to All Scripts Upgrade Training. The 17.1 upgrade training is for current Allscripts users. It is not for someone who does not have Allscripts access. All features may not apply to your workflow. This video is an overview of all the new 17.1 upgrades. There is a play bar at the top of the screen which allows you to pause the video. On the left side of the screen, there is a table of contents if you wish to review any section. To view the training in full screen, press F11 on the keyboard. To return back to the normal view, press F11 again. After each section, you'll be prompted to answer review questions. You must answer the questions in order to go forward. At the end of this introduction, click the X on the upper right of the play bar to exit this video. Then return to the LMS and select the 17.1 upgrade training. If you feel you need hands-on experience, please sign up for a Classroom 17.1 upgrade training class. The 17.1 new features include Note module changes, What's new in problems, and RX module changes. Note module changes. Objectives. At the end of this demonstration, the EHR user will understand and use as needed simple edit, new document views, new medication output format, and macros. V11 notes will now display in a simple edit mode. When you open a V11 note, the sections will display much like they will in a note output. When you click on a particular section, that section will be placed in edit mode. I will click the History of Present Illness section. I'll select abdominal pain and chest pain. When you click on a different section, the previously selected section will display in preview mode. You'll be able to see what that section will actually look like in a note output. I will click the Past Medical History section. I need to scroll up to see the previous section. You notice the previous section is now in preview mode, and the section you are currently in is in edit mode. I will click New. I'll type hypertension in the search box. You can click the magnifying glass to search. I'll select History of Essential Hypertension, and then I'll click OK on the bottom right to be taken back to the note. Now I will click the Surgical History section. You notice the section you are currently in is now in edit mode, and the previous section is in preview mode. You can add items from the ACI like we did with hypertension and preview them in a different section after editing in the note. This completes our demonstration on Simple Edit. Next, I will demonstrate the new document views. Using the new document views. First, I will demo Separate Tab Viewer. As you can see, I'm in the chart. The screen is split into two areas. On the left, I will select Chart Viewer. With the Separate Tab Viewer, you can view notes and scanned images. When you select a note on the left, the note displays on the right. This will allow you to quickly view notes, labs, and scanned images. Now I will demo the Preview Mode view by double-clicking an icon with 3 dots next to a document. Mode, and you notice at the top of the screen you can quickly review the assessment plan and discussion summary. To access the regular note viewer, click the Open in Note Viewer button. Click the X on the upper right to close the preview mode and return to the chart viewer. This completes our demonstration on the new document views. Next, I will demonstrate the new medication output format. There's a new format for displaying medications in the note. This new output format is now available by request. This will require a note modification, so please contact your note builder if your department is interested. Currently, you can display current meds and end of encounter meds in the note output. When you are in edit mode, this is the meds view formatting that you see. On the lower left, you have several output templates. Click View on the lower left to view the note output. In this example, the current meds and end of encounter meds display in alphabetical order. Click Close on the bottom of the screen to close the note output. The next example I will demo displays the new format available. This format displays the current meds and end of encounter meds in numerical order. Click View on the lower left to view the note output. The tabs on the upper left, All and Established, display the output options. Notice the current meds appear as a numbered list with less medication details for a more simpler display. I will scroll down to show the end of encounter meds. Click Close to close the note output and return back to the note. Remember, this new output format is only viewable in the note output, not in edit mode, and is available as a note modification. This completes our demonstration on the new medication output format. Next, I will demonstrate macros. Creating and inserting a text macro in a V11 note. Now I will demo how to create a text macro and insert the macro into a section in the current note. For this example, I will create the macro from within the note. Macros can be created wherever the macro icon appears. This includes the Note Authoring Workspace, Task Detail, and the menu drop-down on the clinical toolbar. On the upper right of the note, I will click the macro icon. The Manage Macros screen displays. Any previously created macros appear here. I will click Create on the lower left to create the macro. I will create an abnormal geriatric macro, which shows the patient's gender and the patient is obese and has Alzheimer's. For this macro, we will use AbGeri. It is helpful to choose a macro name which describes the macro's content. A period has already been entered at the beginning of the shortcut. The description field is optional. This is going to be my abnormal geriatric macro. On the right side of the screen, I will click Show Merge Fields. Show merge fields are fields that can be pulled into the macro. For example, the patient's date of birth. You can scroll to see a list of available fields. For this macro, I will select patient gender, male or female. Now I will add to the macro, the patient is obese and has Alzheimer's. When finished, click Save on the lower right. You can edit a macro by clicking the Edit button. When finished, click Close on the lower right to close the Manage Macros screen. When ready to insert the macro into the note, scroll to the correct section of the note. Type the macro shortcut including the period and then press Enter on the keyboard. I will type AbJerry and press Enter. The macro reads the patient's gender, patient obese and has Alzheimer's. Macros can be used anywhere free texting is allowed. This completes our demonstration on macros. These are the new 17.1 Note module changes. What's new in problems? Objectives. At the end of this demonstration, the EHR user will understand and use as needed the unspecified problem indicator, new HCC icons, clinical qualifier improvement, and PSH content. A new indicator was added to the ACI to help identify unspecified problems. Users do not easily know when they are picking one of these terms, which although billable, often indicates insufficient documentation and possible reimbursement issues. If a problem term is billable but flagged as unspecified, a new indicator displays. I'm in the ACI. I will type stomach in the search box and then click the magnifying glass. When you are assessing a problem or adding a diagnosis to a charge encounter, and that problem or diagnosis does not include a fully specified code, the indicator displays. It is very likely that the unspecified codes would result in claim reviews or denials by the Centers for Medicare and Medicaid Services, CMS. This completes our demonstration on the unspecified problem indicator. Next, I will demonstrate the HCC icons. This demo will give an overview of the HCC icons. From the ACI, on the left in Problems, we see a red HCC icon next to amino acid transport disorder. The HCC icon displays in red until the problem is assessed for the current year. On the left in Problems, we see a green check by sickle cell anemia. The HCC icon displays with a green check mark if it is assessed until January 1 of the next year. I will type diabetes in the search box and click the magnifying glass. The blue HCC icon displays. It is possible to have a blue HCC icon and a plus sign indicating there are more problems you could select. I'm going to select diabetes bronzed. Notice, under active problems, diabetes is magenta. The problem has been assessed and we see a green check mark. Click OK on the bottom right. Click Commit on the top of the screen. Review for accuracy and then click Save and Continue at the bottom of the screen. This completes our demonstration on the new HCC icons. Next, I will demonstrate Clinical Qualifier Improvement. The Select Clinical Qualifier tool is designed to help you with improving the selection of a specific and appropriate ICD-10 code. First, I will demo the current functionality, and then I will demo the new functionality. I'm on the History Builder and Active tabs. From the ACI, I will type epilepsy in the search box and then click the binoculars. The plus sign is your visual clue or indicator that the problem has multiple variations for you to consider. When you select a problem, the Select Clinical Qualifier window displays with multiple problems. For this example, I will select epilepsy. From the epilepsy type section, I will select epileptic spasms. You notice the seizure type is not grayed out. You can choose any combination type. Click OK on the lower right to close the Select Clinical Qualifier window and return to the ACI. I'm now going to demonstrate the new functionality. The steps are the same. I'm on the History Builder and Active tabs. From the ACI, I will type epilepsy in the search box and click the magnifying glass. The plus sign is your visual clue or indicator. I will select epilepsy. I will select epileptic spasms in the section type. You will notice the seizure type has now grayed out, and the active problem list has become more exact based on the choice. This is the improvement from the previous versions. Prior to the upgrade, users were able to choose from filters regardless if the selection was clinically valid. You would select your problem and then click OK. So I'm going to click OK on the lower right to close the Select Clinical Qualifier window and return to the ACI. This completes our demonstration on Clinical Qualifier Improvement. Next, I will demonstrate past surgical history content. One of the new features is the capability to document no history to the past surgical history for our patients. Previously, you had to document no prior history of surgery in the past medical history for our patients. Also, when adding a past surgery, the no history of past surgical history automatically falls off the list. I will demonstrate this new feature. In your ACI, under the History Builder tab, click the PSH tab, and then select Past Surgical History. In the search box, I will type No History and then click the magnifying glass. I'll select No History of Surgery and click OK on the bottom right. Click Commit on the top of the screen. Review for accuracy and click Save and Continue. I'll go to the Problem tab on my component desktop and select Past Surgical History to see the No History of Surgery has been documented in the Past Surgical History section of the chart. Now I'm going to demonstrate that when a surgery is documented, the documentation for no history of surgery will automatically be removed instead of you manually removing it. In the Problem Component Desktop tab, on the lower left, I will click the New button. This will take you to the ACI in the PSH tab. I will type appendectomy in the search box and click the magnifying glass. I will select appendectomy to add it to the chart, and then I will click OK. Click Commit on the top of the screen. Review for accuracy and then click Save and Continue. You will now see the history of appendectomy has been documented and the no history of surgery is gone. This completes our demonstration on past surgical history content. These are the new 17.1 What's New in Problems changes. RX module changes. At the end of this demonstration, the EHR user will understand and use as needed Split RX, RX change, and RX cancel. One feature that no longer will be available is Split RX. Now, when you need to split a prescription between a traditional pharmacy and a mail order pharmacy, you will need to use the duplicate feature. I'm on the medication details screen. You will notice the Split RX option is grayed out. From the medication details screen, I will order Crestor 20 milligrams. I will send the prescription to a retail pharmacy as well as a mail order pharmacy. Make sure to review the SIG information before clicking Save. I will click Save and Return to ACI on the bottom of the screen. The new process is to do two separate orders. I will right-click the checkmark medication and select Duplicate. You will make the necessary edits to send to the mail order pharmacy. Update the number of days and select the number of refills. When finished, you'll click the down arrow and select Send to Mail Order. Click Save and Close ACI on the bottom of the screen. Click Commit on the top of the screen. Review for accuracy and then click Save and Continue on the bottom of the screen. This completes our demonstration on Split RX. Next, I will demonstrate RX change. A new feature is the RX change task. These tasks will come when the pharmacy is requesting a change to the prescription for a therapeutic change. The task will appear in the task view as RX change request. Each RX change request task has a yellow triangle to the left, indicating as soon as possible priority. You will double-click on the task to see the change request. This slide shows the notes for requested changes from the pharmacy. There can be up to 10. If one of the changes is approved, you would click Change Approved. Then this must be done from the medication list using the Cancel RX feature. This completes our demonstration on RX change. Next, I will demonstrate RX cancel. One of the new features of the prescription module is the ability to electronically transmit a request to cancel a medication order to the pharmacy. From the medication list, identify the prescription or prescriptions that need to be canceled. This patient has 2 medications that have previously been transmitted to the pharmacy. You can see this by clicking on the plus sign next to the medication to see the details of the order. For this example, I will click the plus sign next to baclofen to view the transmission status. Verified transmission to pharmacy shows here. I will right-click on the transmitted prescription. Selecting either Enter an Error or Order DC will generate a request to the pharmacy to cancel the prescription. We'll complete the Change Status dialog box. Record DC functionality has not changed. Click Commit on the top of the screen. Review for accuracy and then click Save and Continue. Once the pharmacy receives it, there will be an acknowledgement response in the patient's medication list. In this next section, we will illustrate the steps when a pharmacy denies a medication transmission for any purpose. To view the medication details, click the down arrow next to Current Medications and select All Meds. For this example, the pharmacy denied the request to cancel because the prescription had been transferred to a different pharmacy. You can view the denial reason by clicking on the medication. A denial does not mean the pharmacy is overriding the clinical decision. It simply means that they are unable to cancel the prescription. Here you can see the action, verified transmission to retail pharmacy, and the status, discontinued, denied, pharmacy unable to cancel Rx. Click Audit to see additional details. Here you can see the status and Rx cancel notes. Click Close on the bottom right to close the audit viewer, and then click the red X to close the medication viewer. The task will appear in the ordering provider's task list. A medication which cannot be canceled will generate a delegated task to the provider for follow-up by staff. This delegated task should appear in the clinic's Med Task view. This completes our demonstration on Rx Cancel. These are the new 17.1 Rx module changes. Listed are the new 17.1 upgrade icons. Thank you. This completes our demo on the 17.1 upgrade changes. If you have any questions, please contact the Allscripts team.